Hello, everyone. Welcome to the show. I'm Dr. Ava. I'm an internal medicine hospitalist, and I'm really passionate about increasing diversity in medicine. I wrote a book called Paging Dr. U, geared to those interested in going into the medical field. I'm the owner of Dr. Eva B Coaching, and I coach future medical students. I am hosting Health Moments with Dr. Ava for season 5 of the Hope TV. When it comes to your health, it's important you get your information from a source you can trust. Health Moments with Dr. Ava is about empowerment, empowering you to take charge of your health and well being. We keep it fun, we keep it interesting and informative. During the show, you will hear me give some general medical information. But as always, I recommend you seek the advice of your own personal doctor. Today's show is one really dear to my heart. It's about kidney disease and kidney transplant in the African American community. End stage kidney disease and earlier stages of chronic kidney disease represent one of the most dramatic examples of racial and ethnic disparities in health in our nation. African Americans are 3 times more likely to require renal replacement therapy, which you may know as dialysis, as compared to their white peers. Although African Americans comprise 13% of the US population, we make up about 35% of people with kidney failure. It is a major public health issue. As a group, we also tend to have more risk factors for kidney disease than most other groups. Diabetes, high blood pressure, obesity, and if you have a family history of diabetes or kidney disease, those are the most common risk factors for developing end stage renal disease. If you develop end stage renal disease, you essentially have two options. You either need to get a transplant to receive a healthy kidney from a donor, or you need to start dialysis. I have a guest here with me today who is also a physician and a 2-time kidney transplant recipient. Dr. Philip Douillon is a board certified neurologist who completed his residency in neurology at NYU and fellowship in clinical neurophysiology at NYP Well Cornell Medical College. He's the founder and CEO of the Health, Wellness, and Technology company, the Inley Brain Fit Institute, which was created to provide people's health and quality of life. He has also created individualized exercise regimens based on a person's medical and neurological needs, as well as their personal goals. He developed a Brain Fit app released in November of 2018, which is designed to teach people about the impact of food and exercise on the brain and the body. He is also the author of the book Neuroplasticity, Your Brain's Superpower, which speaks to the brain's ability to learn, adapt, and heal. He is also the creator and instructor of the online class Take Charge of Your Brain in 30 Days, in which he teaches people with medical and neurological disorders to become the leaders that their brains need so that they can be healthy and successful. Welcome, Dr. Douillon, to the show. Thank you so much for being here with us today. How are
Thank you
you?
so much for having me. I'm doing well. I'm looking forward to this. I'm looking forward to sharing my story with you.
Awesome. We're so happy you're here today. So tell us a little bit about your story with kidney disease. When were you first diagnosed?
Yeah, so my history with kidney disease starts when I was 18 years old. And so
Wow.
now I'm 42. So I've had kidney disease more than half my life, my entire adult life. And at 18, I was a freshman in college. I was a college athlete. I had gone for a physical and failed my physical, and they really didn't know why. But they cleared me and allowed me to continue to play my sport. And so I was out of town competing, and I collapsed on the court and had to be rushed to an emergency room in this small little town. And it wasn't until weeks later that I was diagnosed with kidney failure. And so I went through college in kidney failure. I went through medical school in kidney failure. And then, by the grace of God, 8 days after I walked across the stage at Carnegie Hall to receive my medical diploma, I received a kidney transplant. And my donor
So,
at that time was my father.
so let's talk about that for a second. So you went through college and medical school with kidney failure. You mean you were put on dialysis or were you in chronic kidney disease at that time?
Yeah, so I was in end stage renal disease, but did everything possible to avoid dialysis.
Did they
And
ever tell you why you ended up in end stage renal disease at such a young age?
yeah, so initially I was misdiagnosed. I was misdiagnosed with post-streptococcal glomerulonephritis.
Mm,
Inflammation of the kidneys that was due to a strep infection. But later on, it was found that this was more of an autoimmune issue that I
mm.
had and not something related to a virus that I had gotten earlier on.
Okay, I see. When you first realized that you would need a kidney transplant, what were your feelings?
I went through my 20s and I was not happy. I mean, I was angry, I was resentful, I was like, why me? You know, I never did drugs, never drank alcohol, never did any of these things. You know, I was an athlete, I took really good care of my body. And so nobody teaches you how to deal with facing your mortality, especially at an age where you're supposed to feel immortal, right?
Right.
And so I probably did not handle that time period as well as I could have. But it certainly did teach me a lot. And it taught me really about how to relate to the patients I was going to care for. So that way I could guide them through some of the tough situations that they were going to go through.
Is that why you wanted to be a doctor?
No, actually, I wanted to be a doctor before I was diagnosed
Okay.
with kidney disease. And actually, one of the things that I tell people when they have some kind of chronic illness is not to so strongly identify with the illness that you have. There has to be a bigger picture, a purpose in your life. And actually, that purpose that I had at the time of wanting to be a doctor allowed me to focus on that and not so much the disease that I was battling.
Right, right. Yeah, that's powerful. So, what was it like health-wise waiting for a kidney transplant?
So it was tough. I mean, so I was chronically fatigued. I had pains. I had chronic migraines. I had difficulty focusing, especially in medical school. Especially in that second year of medical school, I had to make the decision not even to go to classes and really to do the studying on my own. So I had to make a lot of adjustments. But, there were things that I was still doing, like exercising, spending time with loved ones. Those things really helped to sort of carry me through.
Okay. So, I don't know if you answered that question, but did you ever have to go on dialysis while you were waiting?
So I didn't have to go on dialysis the first time. So did everything to avoid dialysis, and I was able to get that kidney transplant before I needed dialysis. But I certainly had to go on dialysis the second time. I actually had to go on dialysis earlier this year, and I was on dialysis for quite a few months.
So, the first time, did you get a donor, a living donor kidney transplant or deceased donor kidney transplant? And how old were you the first time?
So the first time I was 28 years old, first time I had a transplant, and I was fortunate. I was able to get a transplant from my father, who
Oh,
is still, alive and doing incredibly well and active. So I was certainly blessed that my dad was able to give me
he gave
one
you
of his
life.
kidneys.
He gave your life.
He saved my life. He's given me life twice.
Okay. So you said the first time you got a kidney, so you and your dad were a match, a perfect match,
Yep.
and then
And
you got
actually,
a
you don't
kidney.
need to be a perfect match.
Well,
So,
yeah,
right. So we share half the DNA.
right.
So the way that they score it, he was a good enough match for me, but certainly not a perfect match.
Okay, okay. So how was the process like going through the surgery and having your dad go through his surgery? Walk us through that process a little bit.
Yeah, I think for me at that point, it was tough. It was dealing with a lot of guilt, right? I mean, I was certainly worried for my dad. I didn't want anything to go wrong. I had gotten into a point where, you know, uh, I was struggling and really was at a point where I was like, look, not everybody is meant to last forever. I'm 28 years old. I've had a good run. Like, I didn't want anyone to sacrifice that way for me. But I was lucky because he really fought for me and sort of pushed through. And at that point, I don't think I would have taken a kidney from anybody else, right? And I'm so grateful for going through that experience because just to think about the things that I've done from the time I'm 28 to now at 42, I've accomplished so much. I've helped so many people. I have these two amazing little boys, and so not only did he help save my life, but he's also helped touch the lives of all the people that I've positively impacted.
Wow, that's so powerful.
Today, we're going to be making some key lime cupcakes.
play band with us? I'm gonna play my clarinet.
And Elmo's gonna play his drum. Drum loud.
Oh, well, you know what to do, Julia.
Julia knows.
With Julia's autism, loud sounds can be too much.
But she still loves to make music. Play band.
Early screening for autism can make a lifetime of difference. Find out more at screenforautism.org.
Why do you think these men don't want to get married?
It really depends on an individual's why for getting married. A lot of the things that make a man good are kind of intangible. And his credit score shouldn't be the metric for what makes him good.
Did the kidney transplant give you your normal life back?
Yeah, so it gave me my normal life back. I felt really great. I felt really strong. I was able to go and do my intern year and residency and fellowship and practice like any other doctor would. I was able to be physically active and travel and have a family. So it really gave me a second lease on life, an appreciation for what life truly has to offer.
Yeah, yeah. So you said 2 times. So what happened to the first kidney?
So then after about 14 years, the initial disease process started to come back. And right
Okay.
before the pandemic, I was actually in the process of being worked up for a new kidney transplant. And the pandemic hit and kind of shut all of that down. And I knew with my medical history that if I got this virus, that it was not going to be good for me, right? People with chronic conditions, underlying conditions don't do as well. And so I kept myself in a really small bubble for almost a year, did pretty well. And then January of this year, I got COVID and I got really, really sick and was hospitalized for 2 weeks. And the virus took its toll on my body, but especially on my kidneys. So the remaining kidney function I had left just kind of went out the window. And at that point, I had to face what was actually going to be my biggest fear, which was that I needed to do dialysis. Yeah, I had never wanted to do dialysis, in part because the way that I saw people in the hospital doing dialysis, it always looked like they were so sick and almost ready to die or waiting to die. And so I had to make a decision. I had to decide if I was going to do dialysis the way that I saw all those other people do it, or if I was going to do it my way. And so I decided to do dialysis in a way that really worked for me and continued to allow me to have a really good life.
Peritoneal dialysis or hemodialysis?
So I did hemodialysis. So I
Okay.
would go to a center 3 times a week, Monday, Wednesday, Friday. And I organized the schedule in a way that worked for me. So a lot of times after dialysis, people just don't feel so great. So I would do dialysis at the end of the day, the last shift. So that way I'd get home, I'd eat, and I'd sleep off, any cramps I was feeling or any lethargy I was feeling. And the next day I would wake up and I would feel pretty good. And I would have that day and the next day and a half to kind of do what I needed to do, including work. While I was on dialysis, I traveled because there are dialysis centers all over the world, certainly all over this country. And there are people whose job it is to, if you want to travel, they'll set it up for you. So I would be traveling back and forth. I was, playing sports with my kids. I was physically active. I had a local news company following me around. So I did interviews while on dialysis. I used dialysis, that time period, that 4-hour time period, really as a time for personal growth. I would read, I would listen to podcasts, listen to people that were inspirational. I would rest if I needed to rest. But I certainly decided to do dialysis in a way that really worked well for me.
Okay. So then you got your second transplant.
So I got my second transplant at the end of May.
Was it a living donor transplant again?
Yep. So I am truly blessed because my cousin-in-law, so we're not blood related, he is married to my cousin, decided that he would donate a kidney to me. And so my life has been saved twice, both by really amazing Black men,
People that you knew.
people that I knew.
Yeah.
Yeah.
Yeah. And yeah. So that's why it's so important to put the word out there, talk to people, advocate for people, because sometimes your kidney, your organ might be at proximity, very close to you. It
Yeah,
may not come from a stranger. It might come from somebody you know. So,
absolutely. And it may
go ahead.
come in a way that you don't even have to ask, right? Because if people know that you are struggling, you may have people around that just decide to step up and help in any way that they can. And it doesn't
Wow.
always have to be an organ donation. It can be, they help make food for you, they check in on you, they help take you to dialysis, whatever it is.
Throughout this whole process, what was your biggest fear?
So initially, my biggest fear was doing dialysis, like I said, and I had to face that fear and decide how I was going to do it for myself, which I did. Um, and then I think it was, I've got these two young boys that are now 11 and 9, and knowing that they needed me to be around. And so the biggest fear for me was that I was not going to be around for them. But they were also my biggest inspiration, right? It was like why I continued to fight despite how sick I got with COVID. I remember there was a night in the hospital where I was watching my saturation levels go down, which is never good as a doctor to watch those numbers go down. And I turned, there was a PA that had come to see me that evening, and I said to her, I've got two young boys, so I need you to do everything that you can to save my life. And so they were my biggest inspiration.
Wow. Wow, that's really powerful. And that actually makes me emotional because I've been rounding on COVID patients the whole pandemic, and it's been young, old, everything in between. And it's been very traumatic seeing,
Yeah.
people dying, trying to do everything you can to save their lives, and some of them you just couldn't do anything. So I'm thankful and I'm glad you're here today with us.
Yeah,
Yeah.
I'm certainly grateful, and I'm blessed.
So my next actually better health than when you started. How long does it take after a kidney transplant for you to get back to your old self or even
Well,
better?
so everybody's going to be different. So it's interesting because I had a creatinine that was around 10 or 11 when I went in for my transplant in May. And within 2 days, it had dropped down to 2 and then continued to slowly get better. But obviously, you are recovering from surgery. You're on all these different medications. It does take your body some time to adjust. But 2 to 3 months out, I started to feel significantly better. Um, Now we're we're a little over 5 months out. I mean, I am back on the tennis court. Tennis is a sport that I play. A couple of weeks ago, I got back out on the tennis court. I'm essentially doing everything now that I used to do, and I feel great.
Good, good. So how important it is to take your medications on schedule? Because I know you're on a lot of medicines, right? To help
Yeah,
like not get rejected.
that's right. So I'm on immunosuppressant medications because whenever you put something foreign in your body wants to attack that. And so to suppress my immune system from doing that, I'm on a couple of different immunosuppressants, which I take twice a day in the morning as well as at night. There are antibacterial, antifungals, antiviral medication that I also take to keep me healthy. And besides that, it's just some vitamins that I take. But it's incredibly important to take those medications. I mean, I've seen people in the hospital where they've gotten a transplant and they stop taking their immunosuppressants and then they go into rejection.
Yeah.
Right?
Yeah. And you have to take those medicines scheduled at about the same time every day.
That's right. You do. And certainly when they're testing the levels of those medications, the timing of them is really important. So you want to take them the way that they are prescribed. You
Mhm.
certainly don't want to miss dosages. You don't want to stop. And if you're having side effects, you want to talk to your doctors about them before you just decide to stop medications.
Okay, okay. So what thoughts would you share with someone considering being a living kidney donor or an organ donor?
Yeah, so I would say that the opportunity to really change somebody's life and to save somebody's life is incredible. I'm somebody who truly believes that the reason that we are here living our current lives, it's not for us. It's about the impact that we can have on others. And if you're deciding to be an organ donor, you're not just saving that one life, you are impacting all the lives that that person is going to influence in
Hmm.
the future. And so whether it's my dad or my cousin-in-law, I've always been amazed at not just their willingness to give me a kidney, but the pride and the honor that they took in doing so. And so I would encourage people that if you have that opportunity, it should be something that you should consider because you have the power to influence the lives of people and to save their lives.
That's amazing. I just want to say you're such an inspiration. Thank you so much for sharing your story with us.
Well, look, you might not be popular, but my favorite character is Celestial because
One of the quotes that I wrote down in the book that kind of stood out to me was "Love is the enemy of sound judgment."
She seemed like a very needy woman. And I can't even respect Andre because how do you prey on your friend's wife while he's incarcerated? Like, I just can't get with that. And maybe I got too invested in the book, That
We are still talking all about the season of fall.
Hey, Miss Cam. Hey, Miss Cam. Hey, Miss Cam, I love you.
So you may ask yourself, is kidney disease preventable? Well, it's yes and no. So in the US, the most common reasons why people go into renal failure or have chronic kidney disease, which is what you get before you end up on dialysis, is if you have uncontrolled diabetes or if your blood pressure is not controlled, if you have obesity, sometimes if you have a family history of both, those things can cause you to have renal failure. And those are actually the most common causes. But those are preventable. If you take care of your diabetes, you take care of your blood pressure, you can prevent your kidneys from failing or at least delay the process some, you know? But in the case of our guest, Dr. Douillon, that wasn't preventable. He had an autoimmune disease, and what that means is your body's attacking its organs. So it's his body attacked his kidneys, right? And so that's an autoimmune disease. That is something that's not preventable. Sometimes you can have a virus, a viral infection that causes you to have kidney failure. Those things are unfortunate, they're not preventable. But the most common causes, fortunately, are preventable. And those are obesity, that blood pressure, and diabetes. Do you want to add anything else?
I think you're spot on. So there are things that we can do every single day that minimizes our risk of kidney disease as well as other diseases. But sometimes things happen, right, that are
Mhm.
beyond our control. And the reality is that we will all face challenges in life, and some of them will be health challenges. And what matters most is going to be how we choose to deal with those challenges. And there are things that we can do every day that will help us overcome, that will help us have a different perspective, that will help us get as healthy as possible.
Right. And so, how come you didn't go into nephrology? That's a kidney doctor. Why didn't you become a kidney doctor? Why did you choose neurology with everything you've gone through?
Yeah, so by the time I was in medical school, I was just over kidney disease. And I did not even want to learn about the kidneys at all when I was studying it in like pathology class in the second year of medical school. I was like, I've got personal history with this. I don't want to read it in a book. I don't want to see the patients with this, nothing. So I stayed away from nephrology.
You probably already knew so much about the kidneys anyway because of your research and everything you've gone through and speaking with so many nephrologists. But then you chose neurology. That's totally opposite from, that organ. Not even
That's
close.
right, completely different. And yet my knowledge about the brain is incredibly useful in helping people with kidney diseases as well as other diseases. And so I use that knowledge that I have about how our brain works to help patients with chronic kidney disease, to help patients who are end-stage renal failure, to help those patients on dialysis.
Right, right. So the takeaway is you can definitely prevent certain diseases from happening. Right now, we're talking about kidney disease, but if you have high blood pressure and diabetes, that can also cause other things like heart disease, um, strokes, things like that. So take control of your health. You have the power to make a difference with yourself, and it starts with you. Because a lot of us don't go to the doctor. A lot of African Americans are afraid to go see a doctor. So I'm hoping that this conversation will inspire people to take charge of their health.
Absolutely. And I think the reality is that people are not alone, right? So no matter what you're facing, there's always a group of people that have been through what you've been through. Don't be afraid to reach out to those who have walked, the path ahead of you. Certainly, you can always reach out to me if you're facing kidney disease or dialysis, or you've got an upcoming transplant, as well as any other medical issues you might be facing.
That's amazing. I just want to say you're such an inspiration. Thank you so much for sharing your story with us.
Thank you for having me.
Yeah, is there anything else you want to say? Anything else you want to add for the viewers before we let you go?
Yeah, I think, living a life of purpose is incredibly important. So no matter what challenges that you are facing, always have a bigger picture, always have your purpose in mind. And you should work every day towards that purpose because that will really help you overcome any challenge that you're facing.
Thank you so much for having us. For coming on to the show and telling us about your story.
Well, thank you for having me.
More than 90,000 people in the US are waiting for a kidney donation. It is less common for someone who identifies as African American to be a living donor. It is also harder to find deceased donor kidneys because of blood type challenges. You might think that a transplant is more of a last resort, the thing that we do when we run out of options, but that's hardly the case. For most people, doctors would prefer a transplant over dialysis. And that's because people who get transplants generally live longer than those on dialysis. They tend to have a better quality of life, fewer long-term health problems. They have more energy, less dietary restrictions, and they enjoy returning to work and travel more freely. If you're a patient in need of a kidney, the thought of asking someone to consider donation can be scary, but needing a new kidney to live is nothing to be ashamed of. Asking for a kidney takes courage, so don't be afraid to ask. Do not count people out. Share your story, speak from the heart, and most importantly, be kind to yourself. It's okay if you don't get the answers you hope for on your first try. But by having the conversation, you're educating others about kidney disease and the importance of organ donation. The more conversations you have, the easier it may become. Raising awareness as well as considering being an organ donor is important, but so is advocating for friends or for loved ones who needs a kidney transplant. As always, the first step to correcting disparities is recognizing that they exist. Bringing this issue to the forefront and inviting more discussion will help find the best solution. So I encourage every single one of you to join me in championing for someone in the community that's in need of a kidney donation by becoming an advocate and by spreading the word. Thanks so much to our listeners for tuning in. See you on the next episode of Health Moments with Dr. Ava.
Every discipline starts with creating a habit. Find a plan that works for you. I know you can put a reminder in your phone, call so-and-so in 30 days. You can't use the excuse that, I'm an introvert or I'm an introvert, you know, stuff people like to say. Nah, if you're not outgoing, right, you better get going, because that's the only way networking works.
Welcome to the show. I'm Kawanda Green. Thank you so much for joining us. Two things I know for sure. Kids will play, and in sports, you will have injuries. In the US alone, there are approximately 30 million children under the age of 18 who participates in organized sports. And with that 30 million, we have over 3.5 million injuries per year. That's 3.5 million injuries. That's not even including the collegiate or the professional athletes, or even the everyday people who are just active. But we're just talking about the children. Today, we have a doctor who works in the Orthopedic Sports and Spine Center for Emory. And he has been consistently named in the Atlanta Magazine's top doctor in the past, top doctor issue in the past 5 years. Let's welcome Dr. Augustine Kandua to the show.
Thanks, Kawanda. Thanks for having me. Great to be here.
Thank you so much. Thank you so much for being here. How are you today?
Doing well, doing well. Yourself?
I am fantastic. So, Dr. Kandua, can you tell us a little about yourself and why did you choose orthopedics?
Yes, of course. So I am a native of Ghana in West Africa, and family moved out here in the early 80s. I grew up in Madison, Wisconsin, as well as spent a lot of time in California. I did my undergrad at Stanford University, and then my medical school training, as well as orthopedic residency training at the David Geffen School of Medicine at UCLA. And then went on to do a one-year fellowship in both research as well as an additional year in specifically sports medicine, orthopedic surgery training, where I learned the minimally invasive techniques for treating athletes, everyday people, and weekend warriors as well. I have been married for 14 years to my lovely wife, Shantae, and I have 3 children. We have 3 children together.
Wow, that's so awesome. What made you choose orthopedics? What made you go
I
into
think
that
orthopedics,
field?
great. Yes, actually, I knew I wanted to be a physician from early on. When I say early on, I believe it was in 6th grade where I really had the interest in the sciences and medicine. And that interest really peaked the following year in 7th grade during a show and tell where one of my classmates' fathers, who's actually an orthopedic surgeon, came in to show us a little bit about what he does. He brought in x-rays, he brought in models of bones, as well as various implants that he used, and I was basically sold from there.
What exactly do an orthopedic doctor do?
Yeah, that's a great question. I think the field of orthopedic surgery itself is quite vast. And generally think of orthopedics and you may think of fractures or broken bones, but we do much more than that. We manage both non-surgically and surgically various musculoskeletal conditions. That includes arthritis, which may lead to joint replacement surgery. And it's ultra subspecialized, where we also have subspecialties such as hand surgery, foot and ankle surgery, spine surgery, sports medicine, of course, as well as pediatrics and trauma work.
Okay, you mentioned a couple of things that I want to ask you about. Okay,
Sure.
you mentioned, I think, did you say hip replacement?
Joint replacement,
you
yes,
said
and hip replacement would be included.
Okay, so when someone who's a candidate for a hip or knee replacement?
That's a great question. So for the most part, hip and knee replacement surgery is basically sort of the final and most long-term treatment for arthritis. When we talk about arthritis, it's essentially a wearing away of our joints. Imagine your joints being like a tire. Over time, as we drive, we wear down the tire and we develop arthritis. In my practice, we attempt to treat patients, non-surgically first, whether it be injections of medications into the joint, which could include stem cells versus cortisone injections versus some lubricating injections. Of course, we always, recommend a good exercise program to build up the muscles around the joints, as well as various, medications. And when patients fail these treatments, and if they're debilitated enough by their arthritis, meaning their arthritis dictates their lives, as opposed to them dictating their own life, then that's when patients, come to the realization that a joint replacement may help them. So we don't, take out the entire joint. We basically give the joint a new surface. It's analogous, again, if I use a tire analogy, to putting a new tire on the same car such that the car performs better.
You said you can inject the lubricant in there. How long does that last? I've never heard
great
of that.
question.
How long does that last?
Yeah, the lubricating gels are essentially synthesized components that are similar to some of the components or products that we find in normal joint fluid. And the goal of these medications is to really help with pain. And there are various types of lubricating injections, but they're pretty much all the same. And the goal of which is helping with pain. And they can last upwards of 6 months. I've seen them last longer than 6 months, and I've seen them last less than 6 months. So upwards of 6 months, if you read the the information that the companies will provide, that's typically what they mention.
So what happens after 6 months?
Great question. So essentially, if a patient had great results and the pain relief lasted for 6 months and they're interested, we can certainly repeat the injections, maybe once or twice a year or every 6 months. Some patients really find that as their ideal treatment option in order to avoid surgery, still getting the pain relief they have, and do so in a minimally invasive manner. But at some point, these injections may no longer work, or a patient's looking for longer-term relief. Instead of 6 months, they want years of relief, and that's when the joint replacement becomes an option.
So when people get repeated injections, does that have long-term effects on the body?
It can.
Are there side
when we
effects
talk
from
about
the injection?
Yeah, so it's possible. When we talk about injections, the vast majority of injections involve some form of steroid medication. Now, there has been some evidence in the literature to suggest that the steroids may, over time, cause the cartilage in the joint to become a little bit thin. But there is some mixed data when that is looked at in great detail. Another issue is that there's a large component of my population with diabetics. And steroids, when taken into the system, can cause blood sugars to go up. Typically with injections, that increase in their blood sugar may last hours to days, and it's typically not a long-term effect. In these settings, I recommend patients drink plenty of water over the course of 72 hours after the injection to kind of minimize that possibility.
Okay, Dr. Kandua, you mentioned arthritis. Okay, what about when people have arthritis and they have fluid? They feel like they have fluid in their legs or in their knees. How can they relieve themselves of that fluid? Or
yes, that
does the
fluid
affect the arthritis or make it worse or better? Or
I think part of the response, arthritis is essentially an inflammation that occurs in the joint. And when a joint becomes inflamed, one side effect or one product of that is the cells that line the joint, they produce a fluid in order to pad the joint. And that's manifested as a swollen joint. More often than not, that swelling can be reabsorbed by the body over time. But things that we can do to help that along are icing the joint, providing some gentle compression that's not too tight. And if the swelling begins to cause significant pain and it's taken some time for the swelling to go down, and that's when it's time to see an orthopedic surgeon to discuss having the fluid drained from the knee through a simple injection that involves a needle and some syringes.
How do we know when we're listening to someone who's an idiot juxtaposed to someone who has actually done the stuff they're teaching?
You definitely have a lot of people out there who are talking and talking and talking. So you can double check their work. And if you're seeing that they are saying like the sky is blue, all these other things are saying the sky is red, all right, you might need to start to follow somebody else most likely. So you can Google what is a stock, what is a REIT, what are some good stocks to invest in, what's an index fund, so on and so on. I always think that's the best place to start.
Hey, world, I have a quick message. It's about safe driving. All right, let's go. Anytime you're driving, have the seatbelt buckled tight. Both hands on the wheel and your phone out of sight. When not in your hand trying to text somebody back. Because if you do, your car might get smacked. The moral of the story, just put your phone down. The people on the road will stay safe and sound. Put your phone down, put your phone down. People on the road will stay safe and sound. Yeah.
I work in the #1 cable news network in the #1 market in the nation, and I'm the only full-time African-American woman in my newsroom. Being inspired is really saying that at the end of the day, no matter what's happening in my world or around me, it's bigger than me.
Do people have to have a referral to come to you, or can they just call up an orthopedic doctor and just go for a visit?
Actually, both are possible, and unfortunately, some of that is dictated by the insurance that one may have. Unfortunately, again, insurance has, come into play when it comes to making healthcare decisions in terms of what physicians think are best. But for the most part, patients are able to call us directly and come in to see us without a referral from their primary care physician.
Okay, so although death from sports injury is rare, softball and baseball is at the top, with 3 to 4 kids dying every year. And I read that brain injury is the leading cause of death. Why do you think that baseball and softball is the top of the list when it comes to death and sports injuries?
And the most likely explanation for this is, with baseball and softball, you're dealing with high velocity, high speed projectiles, basically the softball and the baseball. And when you mix that with a direct blow to the head, it can cause some serious injuries that could include anything from, a headache to a concussion to actual bleeding in the brain, which can lead to more serious consequences.
Okay, I read that you work out a lot. Did you play any sports when you were in college or high school?
That's an interesting story. I did play sports growing up and upward until sophomore year in high school, when my parents, who are traditional West African parents, said, "Hey, put the ball down and pick up the books." Although I always had a book in the other hand. So that was sort of the end of my sporting career, but I still continue to maintain a level of activity, whether it be, weekend warrior-like sports, working out, which included either weight training or cardiovascular activity. I think that's definitely important, especially in our population, to minimize, the side effects or long-term effects from the chronic illnesses that tend to plague our community.
Yeah, a lot of people, we could say that the pandemic last year has kept a lot of people in the house, but a lot of people have kind of shied away from going outside and doing exercise and working out. But don't that help your joints and, your bones when you at least do walking or some sort of activity?
Yes, certainly. I oftentimes, encounter patients that tell me that sometimes as they move their joint, they hurt less. But when they've been sitting for a while and then they go to stand or sit, they start to hurt, particularly in the knee. So I think exercise and moving around is certainly important. For the joints, number one, it helps build the muscles around the joint, which can help support the joint and decrease pain or decrease the likelihood of injury to that joint. Secondly, our bones are actually, living, breathing organs. And similar to muscle, if you do not use it, you lose it. So the bones actually like to see force. If you were to look at an x-ray of someone that had been doing nothing but maybe sitting for a period of 1 month versus a similar individual who was more active, you would certainly see a difference in their bone structure. They would have stronger bone, which would appear as more white on an x-ray.
Wow. I heard that vitamin D can affect a lot of things. Is there any significance to, vitamin D and our bones? Does it affect our bones?
Yes, definitely. Vitamin D is intimately related and directly related to how we metabolize various elements and how we metabolize to form bone and to build bone. Directly related to that, as folks may or may not know, vitamin D, the primary source of vitamin D is actually the sun, as far as synthesizing or making vitamin D through a reaction that occurs at your skin. So as opposed to taking supplements, I think the best thing you can do to help with your vitamin D metabolism is to go outside.
So they can knock out two birds with one stone. They can go get some activity and get some vitamin D at the same time.
Exactly. Yes, ma'am.
Dr. Kandua, the sports have become so competitive. Kids are starting like strenuous training at younger and younger ages. Have you noticed that the injuries have been that, you've seen more injuries with the kids?
Oh, yes, without a doubt. We've certainly seen injuries that you would typically see in a high-level athlete in much younger populations. I mean, things such as ACL injuries in 8 and 9-year-olds. I think the issues are the societal pressures, as well as the pressure to compete, advance, and win has been sort of trickled down to the younger and younger population, where you're having kids that start to ultra specialize. When I was growing up, I played everything, and I played sports throughout the year, different sports, whether it be soccer, football, basketball, and with different sports, you use different muscles. Now what we're seeing is, our kids that are playing a single sport, and they're playing that single sport year round. Take baseball for an example. There's travel teams where you can drive to Florida in the winter and still play baseball. So these kids are playing the same sport, using the same muscles, loading the same types of joints over and over and over. And that basically leads to overuse injuries, which we're seeing manifest as fractures, tendon tears, and significant injuries in our younger population.
Wow. So would you have any warnings or some suggestions or advice for parents of these kids, putting all this pressure, on the kids and them just doing one sport?
Yes, of course. I think it certainly starts with the parents and having them, building that rapport with parents and building that understanding. That I think it first starts, with the parents speaking to the child, or even a physician, with the child present, in terms of, number one, encouraging the child to let them know if they're playing hurt, or if they have injuries, or if they have pain. Because it's not a matter of, no pain, no gain. It's not a matter of necessarily pushing through it. I mean, there's a difference between playing, where you're hurt versus injured. And I'd say the latter is more significant. So that's number one. And then with that explanation and really understanding that a single sport using the same muscle groups over and over and over can lead to injury, that may sort of decrease the need of that parent or want to have them play that same sport year round. They can still be active. They can play another sport, during another season. Like, for example, you play basketball in the winter instead of playing baseball throughout. So I think that'll certainly help, reduce the risk. But, there's a lot of external pressures that are out of your control. Some parents, these athletes that have trainers and that are playing the same sport throughout the year, they think their son or daughter is going to be the next great. So they're willing to invest a lot, and it's hard to, to discuss the other approach to minimize injury to that child. And I think, in addition to the physical, ailments or injuries, it's possible to have, psychological trauma in these children who have such high expectations placed on them at such a young age.
Could there be some long-term damage, with the kids starting so young and going so hard, so young, for so long?
Yes, there is, and there can be. And when we say long-term, I mean, we're seeing these issues even within their childhood. For example, let's take if someone tears their ACL, which is a primary ligament in the knee that helps support the knee, imagine the ACL as the brakes for a car. So if someone tears their ACL, 9 out of 10 times they were doing something that was quite active, so they need that ACL to be reconstructed. So studies have shown us that patients that have had a torn ACL and had it reconstructed, they have higher rates of early onset arthritis. Now, I have x-rays of patients at age 16 and 17 who already have arthritis, which we typically don't see until 50, 60, 70, and 80-year-olds. So there are long-term effects of overtraining at an early age, which predisposes these children to these injuries, which oftentimes may need surgery. And the result of having that injury can lead to the joint just not functionally normal. You know, as surgeons, we like to think that we're great, but we can never, you know, give you back what God made. So we're seeing some of these effects as a result of repetitive overuse injuries or doing a lot at a young age. So we've got to kind of walk that line as far as staying active and participating in sports and being safe at the same time.
It's a topic that's kind of taboo. We talk about it in and out, but we really never just come out and say, let's just go on and talk about this fertility thing.
And the thing about it is a lot of people just assume that everybody can easily conceive, and that is just not the case.
Having a community of Black women that are going through the same thing that I am has made it easier for me to talk about it and has been a tremendous amount of support.
So if you get a 16, 17, 18-year-old who's developing arthritis, what can they do? Is there anything that they can do to kind of repair that and be able to get back on the court or the field and perform at a high level?
Yeah, another great question. You know, with arthritis, I would call arthritis a diagnosis that we see on an x-ray. I say that because we have instances where patients have arthritis on the x-ray, but they say, "Doc, I'm fine, I don't have any pain." Versus the other side where patients are writhing in pain, they're debilitated by the arthritis. If a 16-year-old develops arthritis, there's nothing that we have, you know, in our toolbox per se, or with the research that we have to reverse that process. Again, I go to the analogy of the car because it's something that people can easily grasp. Imagine a tire that's worn out, and that's the arthritis. You can't really put a new tread on that tire. Instead, you have to drive the car differently until it comes time for a new tire. So in these very young patients, that, you know, it really poses a difficult, you know, situation for us as practitioners, for the child themselves, as well as their parents, in terms of how are they going to, you know, deal with the rest of their life with this arthritis pain, secondary to maybe something that could potentially have been prevented.
You know, you mentioned stress fractures earlier, and both of my children had stress fractures. Actually, both of them have rods in their legs.
Oh, wow.
Yeah, my daughter has a rod in, I don't know, one of her legs, and she got screws in the other foot. And when she was at Florida State, the doctor said that he's seen so many kids, athletes come in with stress fractures. And my son actually has rods in both of his legs because he had stress fractures in both of his legs that wouldn't heal. So do you think that people who get, you know, rods or screws, could they, you know, perform at a high level again? Is there some training that they can do, or is it just, well, sorry, it's over?
No, that's a great question. So to take a step back, so a stress fracture, as you know, is essentially basically an area that starts to break at a specific bone because it's under significant stress. Now, traditionally, even when I was training, we typically would only see stress fractures in ultra marathoners or in runners who ran to a significant degree. And the classic story is that of a military recruit that does a lot of marching, developing these stress fractures. So I think the reasons why we're seeing them in kids, again, is that overtraining, that pressure to play every day, on weekends, et cetera, which increases, the load on their joints. And, many kids' bodies are just not designed, to withstand the pressures that they're seeing as far as physically. Now, another issue may directly be related to nutrition. We know that the nutritional status of many of our kids has changed, and it may not be what it should be as far as the balanced diet with, fruits and vegetables, lean proteins, et cetera. Everything is sort of grab and go, high sugar, low nutritional content. So I think, diet and nutrition play a critical role as well. And as well as getting outside, that goes back to, getting sunlight to increase the vitamin D metabolism to help as far as stronger bones. But yes, we've certainly, with all these factors, have seen an increase in the amount of stress fractures that we're seeing in children.
Wow, you mentioned going outside. That's interesting because you see kids today, they're in the house. When we were growing up, we were outside all the time. They're on their phones or on playing the game or watching TV in the house. They're not getting that vitamin D. So what can they do to strengthen their bones? Well, you said naturally vitamin D or some supplements, but is there, some foods that they can eat? You said they also need a balanced diet. What are some foods that you'd recommend?
Well, I think in general, a healthy dose of fruits and vegetables. And again, lean proteins, and also, calcium, and an easy source is obviously milk, cheese, et cetera. But I think, more than that, I think sort of relying on maybe a supplement or food to help with overall, physical fitness. I think we need to lean as much on activity as we do on diet. So, if you're stuck inside, instead of playing the video game, we can put on something that has, some motion to it. And there are actually some video games that encourage motion and movement that you can really get a good workout at. So that could be something or a technique to merge the two where they're playing, but yet getting a physically demanding workout as well.
You mentioned the milk, and growing up, we've always heard milk does the body good, milk makes your bones strong. But, I'm sure milk is doing all of that because of what they put in the milk. And then you think about the milk is putting the mucus in the body. So maybe we can think of something other than the milk to strengthen the bones. Bones. I'm not sure people like milk, but
Yeah, there are fruits and vegetables that are higher in calcium content. The names of which escape me currently, but certainly milk, we don't necessarily need to rely on milk as a significant or main source of calcium. But I think, again, what's more important is the activity, combined, with a balanced diet, and also getting outside and getting plenty of exposure to the sun, because that's just not happening as often as it did, as you mentioned.
Okay, so we're gonna kind of wrap this up. What do you think, or what can you suggest for the athletes? What can they do to kind of prevent some of these injuries? I know they're going to play and they want to be the best and they want to be on the great teams. So they got to put in the work and they're going to have to do it. So what are some things that they can do to kind of protect themselves?
Sure. I think there are several things. I think, going back to number one, listening to your body and being honest with the symptoms that you're having. Because, pain that's consistent or persistent while you're working out or having, or participating in a physical activity or sport is important. And that's the signal to you from your body that you're probably doing too much. And then secondly, as I mentioned, cross training. You could still be an elite football player, but you don't have to play football year round. You can play other sports. You can weight train. You can run. You can get in the water. You can play basketball, etc. And then also, it's important to. It seems pretty elementary, but you'd be surprised at how many people do not stretch or warm up prior to exercising. And there's different types of stretching and warming up. There's the more static, where you're actually stretching the muscles and the tendons. And then there's more dynamic things like doing jumping jacks or high knees or jogging in place to get the heart rate up and get the blood flowing before you participate in these activities. So it's about, listening to your body, being prepared, really doing what's right for you, and having, it's almost like investments. You want to diversify as far as the activities that you do.
I am so glad you mentioned stretching, because older people, we don't want to stretch. We just want to go out there and, go walk or exercise or play or whatever. And we don't stretch, and we should. And we're probably the main ones who should.
Agreed. I think stretching is valuable, especially as we mature and our joints and tendons become less flexible. They're at higher risk for injury. So I think it's certainly important.
Okay, and one more thing. What is something that people can do to reduce the recovery time when they tear an ACL or injure their ACL? Because isn't that a long process, recovery time?
It is. As I mentioned, ACL is a ligament in the knee that helps with stability of the knee. And when we do the surgery, more often than not, we actually reconstruct the ACL, meaning we replace it with another ligament. And that's as close as we can come at this particular time. In rare cases, we can actually repair the ACL and put it back where it belongs, but that's more rare as far as the type of surgery. So the healing process isn't just about how the knee feels, but there's also biology involved. And it takes time for the new ACL to incorporate and become part of your body, almost as one. And that process takes months. We're talking 6, 9, 12 months. And that's one reason why the recovery for ACL is so long. The patient may feel well, but their body isn't ready as far as challenging the knee, getting back in those sport-specific activities in order to minimize the risk of re-rupture. So that's part of the reason why it takes so long. It's the biology of the healing that takes this time.
Ooh, I'm glad you said you may feel well, but your body isn't ready. And I'm sure there are a lot of athletes, especially the ones who really want to win, and they're on this top team and they want to get out there. But if they're not ready, they need to sit it out, because it could be a long-term effect on their body, right?
Exactly. They can predispose themselves to re-rupture, and then they're having yet another setback that puts them out another season. So I think it can be difficult for folks to grasp because they say, hey, doc, my body feels so well, I'm ready to go. But you almost have to protect people from themselves in those particular cases. So I think with having, parental involvement, spousal involvement, family involvement, expertise from a healthcare provider, that can help minimize, the unnecessary, re-injuries after surgery.
Okay, Dr. Kandua, are there any encouraging words you want to leave with our viewers today?
Yes, of course. It's been a pleasure being on with you today. I really appreciate the time. I think, especially in our community, physical fitness and activity is of the utmost importance. And you don't have to, really make a big deal out of it, such as stretching. You don't have to get in a pair of sweats and put a floor mat on the floor and start stretching. You can do things at your desk. I think setting specific and smaller goals to allow them to be achievable will allow folks to really, meet their goals, whether it be weight loss or a particular form of activity. So start small and aim big.
I love it. Thank you so much for being here. I really enjoyed this conversation. You've given us so much great information. And thank you for joining us. Thank you. And thank you for joining us. Remember, be careful, stay active, and always remember, if you have health, you have hope. And if you have hope, you have everything. Don't lose hope. We'll see you next time.
the trenches to understanding of dancing with darkness to realizing that I had to be broken to be a light. Outside of the titles, outside of the responsibilities, what I owe God is everything. And so I speak from a solid foundation of knowing that I'm not my past circumstances, I'm not my past situations, I'm not my trauma, but I am who He's called me to be.
Thank you.